Good morning. Make yourself at home and we'll get started in just a couple minutes. Hey, Ansley, do you know if anyone else is in the waiting room or if we should maybe just go ahead and get started?
I think we should go ahead and get started.
Great. Ansley, Cheryl, since it's a small group today, it would be helpful to us if you're able to come off camera. And since we're a small number, it can be more of a conversation and a presentation from us to you when we can focus on whatever you're interested in. If you're not able to come off camera, that's fine, but we want to invite you to be a little more formally engaged since we're a small group. Um, Jacob, want to kick us off? Great. So, Ansley, good to see you. Love your background, and your cute pillow. My name is Maddie. I'm an associate director for research at the Global Impact Investing Network. Before the GIN, I worked in impact monitoring and evaluation in the Middle East, North Africa region, some health projects, some not, some education, and I bring that lens to the impact investing data space. Jacob, over to you, and Cheryl, good to see you.
Yeah, good morning, everyone. Good to see everyone. My name is Jacob. I've worked on the research team at the GIN for a little over 2 years now, coming from a background in a wide medley of different kinds of nonprofits. But I've really enjoyed being at the GIN and working in impact performance with my coworkers like Maddie. So I'm passing it back to you, Maddie, and you can start to take us through our conversation about what is impact investing.
Yeah, actually, since we're a super small group, could I ask you guys to introduce yourselves briefly? Just like what brought you here, what you're working on.
Hi, I'm Ansley from Global Health Council, and I do a lot of advocacy in DC on the global health budget and appropriations process.
Hi, excuse me, I'm Cheryl Morgan. I work with Catholic Relief Services. And we have a variety of different programming around the world. And I just kind of wanted to hear more about your guys' product. Over.
Jacob, is Catholic Relief Services a member you either are or were?
I'm not 100% sure. We might be. I mean, we're such a big organization and I work in such a
Yeah.
small niche part of the organization. So I'm not 100% sure.
Last question, Cheryl. Are you in Baltimore?
I am.
I'm secretly in Baltimore, and I always say DC when I'm on international calls, but I'm in Canton, Baltimore, and I'm a big fan. I moved here last year.
Nice, and I'm in Federal Hill, so we're not too far from each
Oh
other.
my gosh, you're across the water.
Yes.
Oh, that makes me happy this morning. I've been, Jacob knows, pitching a Baltimore office to everyone who will listen. Um, cool. Well, let's talk about impact investing and stop us if you already know what we're talking about. I know Catholic Relief Services has certainly dipped your toes in here. But Jacob, if you could take us to the next slide. So wanted to touch on what are our impact investments. At the GIN, we define impact investments as those made with the intention to generate a positive, measurable social and environmental impact alongside financial return. This can happen in both emerging and developed markets. So in the Catholic Relief Services case, or in the Global Health Council cases, it would probably be in emerging markets, so Sub-Saharan Africa, Southeast Asia. It can be across asset classes that is public debt, public equity, private debt, private equity. It can be real assets, so that's the housing market or infrastructure. It can target a range of financial returns. So market rate, concessional, that's 1% return, a 5% return, whatever that return margin is. But what it's not is traditional philanthropy or grants made without the expectation of return. Something that we hear a lot, and I used to work with philanthropists and international donors and grant makers, and people get excited because they hear impact investment and they think it's a way of bringing magic bullet private capital to global development projects. And it's just because they're impactful. And it's not that way. I mean, I wish it was. It's more that there has to be a return-seeking investment of some kind in order to make it viable for whatever asset class it's in, be that private equity, private debt, etc. So it can't be financial investments which consider impact. It also, sorry, on the flip side of that, it can't be financial investments which consider impact post facto. So a private equity investment in a South African company that didn't really think about impact, and then after the fact is like, that's cool, we had an impact in an emerging market economy. That doesn't count either. And yeah, it's not anything that we happen to think is impactful. We try to hold ourselves to a definition across the board. So next slide, please, Jacob. I'm going to drop in the chat our most recent report on impact investing globally. It's sizing the market, but this is what we found in terms of who is impact investing globally. It's primarily investment managers, and that includes private equity and venture capital. It's a lot of pension funds, and at the GIN, we do a lot of work with pension funds, trying to bring them onto the scene. And I imagine that's an area potentially of overlap with Global Health Council, is how can we make pension funds part of the solution, especially because they represent such a large proportion, an outsized proportion of global impact assets under management. And so they impact invest, we're trying to make them impact invest more. Development finance institutions, important and key players. We also see that most of the capital is based in the US and Europe. And this can be a challenge, particularly when we're talking about global health, because even the dollars that are invested into emerging economies are usually coming from the US and Europe. So how can we help the people who hold the capital understand the places where they're investing money? And how can we enable people in emerging market economies to be investing in their own markets? I see we have someone new joined us, and it's a small call. So I wanted to invite you, Hari, to come off camera if you are able, and to introduce yourself if you are able. And if you're just popping in and would prefer to stay off camera, that's also fine. Just wanted to invite you since we're a small call. Next slide, please, Jacob. So briefly, who are we to talk about this? The Global Impact Investing Network champions impact investing worldwide. We're a community of practice of 300 plus investors, an impact investing service provider. So that includes a handful of contractors, a handful of other financial structures worldwide that help investors integrate impact considerations into investment management. We're big on data, evidence, and insights, and Jacob and I work on the research team. So we push investors to make informed decisions related to their investments. And we reach a network of about 30,000 now on 6 continents. So let me switch, next slide, Jacob, to how that looks in the healthcare space. And again, for those who just joined, wanted to tell you we're a small group, so please, if you have questions, stop me. If you already know things, push us on. And we want this to be more of a conversation since we're a small group. Next slide, Jacob. So healthcare is one of the most important sectors for impact investors. This is reporting from our annual State of the Market report. So for impact investors and for those who just joined, that's investors who are seeking a social or environmental return alongside their financial investment. For those types of investors, healthcare is actually the most invested in sector. So what we see on the right-hand side is the proportion of investors making at least one investment into a sector. And healthcare's, number one, followed by food and agriculture, and energy. As in terms of the proportion of global impact investing dollars invested into healthcare, it's not number one. That's energy, and has been for a couple years running. I would guess because of the climate intersection. So part of our work in healthcare, and for those who want to increase impact investing dollars in healthcare, is showing investors those climate overlays, which I know you all do a lot of at Global Health Council. Next slide, please, Jacob. We also see investors love the SDGs. Impact investors love the SDGs, and it's SDG 3 for good health and well-being is number 2 among goals they target, close second to decent work and economic growth, followed by climate action. And again, we know these oversect and overlay, but we're excited to see it being number 2. Next slide, sorry. Last thing, and a good sign for healthcare impact investment. Most investors expect to increase their investment in healthcare in the coming years. So more than half say they're going to increase, about 43% say they're going to maintain, and just 3% say they'll decrease their allocations to health. So these are, just expectations. It's what people ballpark or think they'll do in the coming years. But healthcare has a positive outlook from financial investors. So I'll walk you guys through an example of what an impact investment might look like. And I'm sure there are some from your organizations also. But the way this looks at Johnson & Johnson, they have an impact investing fund called Johnson & Johnson Impact Investors, and they invested in this example in South Lake Medical Center near Lake Naivasha, Kenya. It's a historic flower growing region. A lot of the people living there are low-wage farm workers who harvest flowers and work on farms. South Lake Medical Center started as a super small facility, just catering to people's basic needs. But with the help of one entrepreneur who saw that people had greater needs than what a little small medical center could offer, they started expanding, and today they're a 27-bed hospital serving a 50,000 member community. That started with a Johnson & Johnson private equity investment into South Lake Medical Center in 2019, coupled with technical assistance, which is what you see in the bottom right corner, is Johnson & Johnson staff and employees doing a lot of hands-on mentorship of South Lake Medical Center staff. And when those, and we see a lot of that in impact investing, it's a private equity investment coupled with some type of hands-on support for the investee. And so that helped them scale to 27 beds. Johnson & Johnson gets their good return on investment. The community gets a functioning and exciting medical center with a brand new surgical wing. And that's what we hope to see from a financial investment that also has positive social return. I see we have one new person joining us as we move to the next section. So any questions here and before we move on? Great. Jacob, take us away.
Sounds great, Maddie. So Impact investing, for as much as the field has grown, it's hit over $1 trillion in market size as of a few years ago. The impact investing field is relatively new. It started about 15 years ago, and it's multidisciplinary in the sense that it combines many different kinds of expertise and many different kinds of knowledge. A lot of investors come from a strong finance background and may not be aware of things like monitoring and evaluation or other common ideas in the realm of social impact. A lot of individuals in the realm of social impact may not know about, debt financing or the Black-Scholes equation or things that come more naturally to those working in finance. So since the Gen's inception, a huge part of our work has been about creating avenues of communication, about standardizing language, metrics, data, and so forth to allow all the different parts of an impact investment to talk to each other and to really understand each other and speak a common language. So I'm going to be going through 2 tools today that the Gen has made freely available for all on our website that we believe can help everyone, no matter what their relation is to impact investment, have a strong and productive discourse around it. And Maddie, I see we have some things in the chat. If there's anything that I need to respond to, just let me know.
I will, although it's just me, I'm dropping more of our reports in the chat. So please feel free to ask questions there and I'll flag them for Jacob.
Thanks. The first tool that the Gen launched is the Iris Plus catalog of metrics. Iris Plus is essentially a large collection of different kinds of impact data that impact investors can collect in the first place. As soon as impact investments started happening, the first question that everyone asked was, well, what's an impact? And in some impact investments, that can be pretty obvious. For example, in healthcare, it's pretty key or pretty obvious what the impacts of a given intervention are going to be. Maybe it's patients treated, maybe it's going to be savings on medical devices, maybe it's going to be vaccines administered. But a lot of times, investors or even other actors are going in blind. And even if they know the generalities of what the impact is, they may not know the specifics. Iris Plus helps to solve these needs in 3 ways. The first is consistency and standardization. Iris Plus is a hub that speaks its own language to itself, is internally consistent, and can be externally applied across many different investments. There are impact investors who have been using Iris Plus since the day it came out, which I think originally Iris came out 10 years ago and added the plus about 3 years ago. The core metrics set is the other need this addresses, which is just the question of what metrics should be measured, what data points should be gathered. And finally, the only way that all of this is possible in a responsible and generative way is by integrating the best kind of resources possible. Iris Plus is not a bunch of people at the Gen looking at different sectors and deciding with our limited expertise what metrics matter. No, Iris Plus creates working groups for every single theme, which has sector experts, international organizations, all the capacity and resource builders we can find. We open it up for public comment, and it's a long iterative process. So through and through, what Iris Plus helps to solve is the question of a language of impact itself. What is a metric? How is it calculated? We're happy to say that Iris Plus has had great success in this as a global standard for impact investing. We've had over 500,000 visitors on the site, which is, once again, free to use. and free to make a profile on if you want to construct your own frameworks. 86% of impact investors in the recent Financial Times publication on impact investing index as an index use Iris Plus in their day-to-day provisions, which is second only to the SDG goals. Finally, there's over 32,000 subscribers to Iris Plus. Hopefully, this shows that Iris Plus is not only strong in theory and has a strong theoretical foundation, but is also able to have market influence and be a language that is spoken across the spectrum, aligning different interests. So one example of this might be if you have an asset owner, which would be someone whose money it is, say a pension fund, who gives that money to a fund manager to make an investment in an investee. How do you ensure that the same data, calculated in the same way, is getting passed through all those steps? That's the problem that Iris Plus seeks to solve. And I'm excited to be able to walk you through a little demo real quickly of how the Iris Plus framework functions. This is the Iris Plus page. When you log in with a free account, you can also just generally search it for free without an account. But this framework builder aims to walk individuals through what metrics and what data should be created based on what kind of priorities the organization has. So let's do a healthcare operation here. And you can select by SDGs or impact categories. So let's go to health. Let's say we want to look at access to quality healthcare and move forward with that. Iris Plus will ask you to pick more specific goals to narrow down the kind of operation. Let's say early childhood care, and well, I guess that kind of cuts across healthcare and education, but you say improving early childhood care and education. Just from these quick inputs, Iris Plus is able to build out a whole suite of options, metrics, and resources that can start to help inform and shape the way that the investment can be interpreted, can be managed, can be evaluated. So all of this is just general information, but if you really drill down to the core metric set, this is the heart of the Iris Plus system that really breaks down what should be measured and how. For example, what is the goal? Can be measured through Iris metrics, like the objective of the intervention, as well as indicators like the number of clients who are developmentally on track. You can look at the number, the absolute number, which is scale. You can look at the depth, the percent change, and each one of these indicators has a full built out page. So you can click on it and it provides more information as deep down as calculation guidance, as well as the way in which these metrics interact with each other. The idea is that by standardizing calculation guidance, formulas, even terminology can sometimes get shaken up or lost in translation, absent something like Iris Plus.
Can I ask a
This a lot.
question? Sorry,
Yes, absolutely.
there's not that many of us here, and I just was gonna just jump in. I'm curious, so in the world of, private equity and VC, I know there's different firms will have different levels of, accompaniment or, generally will have a seat on the board or have some level of visibility into how the business is doing. And I'm sure there's, different levels of impact or, effectiveness measures that they're looking at, but I'm wondering how this compares to how for-profit investments might be structured. Because one of the things when I look at this for the social sector is, you know, there's a real cost to collecting this data and having the systems in place to even be able to do this. And when you talk about organizations that are structured as more like social good organizations and have been fundamentally uninvested in for decades, for example, this could be this is just a different mindset. And so I'm curious, you know, whether whether these investments, how you structure them so that that's kind of kept in mind, the cost of that and the timeline potentially to get to a point to have like a well-running metrics outcome can be there. I think about this because I get the impression that there's some types of investments in the for-profit world that, you know, you're looking at financial statements essentially, but there can be much higher levels of trust almost of giving that money over and giving a length of time and a leash to figure that out. Whereas in this sector, you know, different grant mechanisms, different ways of thinking about impact investing can be quite, you know, tightly monitored. And I appreciate the accountability structures, but I'm curious your thought on that.
Yeah, that's a really, really good question. I'm going to try to break it up into two questions here because, well, I think they're related, but there's this question of whether or how impact investments differ from private investments in terms of the day-to-day operations and the impact. And then there's secondly this question about where does the cost for monitoring get shouldered? How do we ensure that it's not prohibitive? So answering the first question about private investments, the difference between a private investment and an impact investment is an accountability for the investor themselves. I don't want to make broad generalizations about non-impact investors, but a lot of times their mandate, company down, is to maximize profits. So even if there happens to be an alignment of profit maximization with, say, service provision, you know, the profit is always going to be prioritized and always put first, no matter what. So if there's a situation where there's a question of, well, do we make more money or do we create more impact? In a private investment, the answer will always be make more money. And the truth is, this can be just as involved as any kind of impact decision. A lot of times, private equities and VCs are sitting on boards and going and telling people, make more money, cut some employees, you know, go for more growth. So I think that if if non-impact investments are able to create impact, it's maybe a happy accident, but this isn't an impact investment because we believe that the intention is key and that without the intention to create impact, impact will not be created at the level that it could be. As far as the question of monitoring and costs, this is a question that comes up a lot. And of course, there's two angles to this. On the one hand, you absolutely don't want to throttle a company, especially if they're new, with additional burdens or costs. On the other, there is a lot of concern about greenwashing in the industry and the legitimacy of impact. This has been particularly true. We've seen some large-scale greenwashing scandals like the Credit Suisse raid in the last few years. And so there is this careful balance that needs to be struck. And often that balance is struck at the deal level between impact investors and their investments. A lot of times, impact investors will write in terms of data collection, will specify where the cost is borne, they will specify sometimes in investment terms that they're willing to be flexible on returns of loans or equity if there's impact. Like all investments, impact investing comes down to a relationship between the investor and the investee. And I know it's pretty unsatisfying to say that it will get worked out between individuals, but the truth is that this is how it happens. And I think that impact investors, once again, I don't want to make generalizations, but I do think that impact investors are less aggressively monitoring than at least what I've seen from grants in my household. My dad is a grant writer, so I know how stringent some of those reporting requirements can be. But I think it's just about, managing that relationship and trying to understand what kinds of companies can do what. For example, we work with an investor who makes a lot of impact investments and early stage companies in emerging markets. And we talk to them about data, and they say, well, you guys, we don't have that great data, but that's something we knew going into this. We think that it's more important to let our investees do their thing than to collect perfect data. And they're transparent about that. When they release their impact report, they say, we don't have as good data as everyone else. What we do have is a really special market. So I think so much of this is still being worked out. And I know this was a really long answer, but I hope this helps to see some of the value add of impact investing, as well as the ways in which monitoring can be negotiated and communicated.
Jacob, if I could jump in, because there are a couple follow-up questions in the chat.
Nice.
And there are, Rachel, thanks for this question, because I think it gets at like the very heart and core of what we do is why would a for-profit investor care about impact? And everything Jacob said is true. What you're describing in your comment seems similar to pay for performance or pay for success or social impact bonds, which is a for-profit investment that's tied to an outcome metric, and financial health of the invested could be one of them. But something we talk about a lot at the GIN that might be interesting to you if you're at Brigham and Women's, although I know you probably don't work on the investment side, or maybe you do, is what, sorry, I'm losing my train of thought, is what's in it for the different type of investors. So Jacob touched on this, but we talked to a lot of pension funds, for example, that let's say you're a South African pension fund. And and you realize that your pensioners are drawing down their pensions early because they can't afford their housing or they can't afford their HIV medication. It's in your interest as the for-profit investor not to be harming your own bottom line by, so you would want to make an investment, say in affordable housing or affordable medication or efficient distribution of medication or a better medical supply chain, because that will prevent your pensioners from drawing down their pensions, and that actually helps you. People don't always make those connections, and there's, especially in big foundations, I assume at Brigham and Women's, a big firewall between your endowment and your grant making. But you can try and point out to people, and maybe this is, I mean, you've probably had these conversations in your MBA, a conversation you can start with people around, is our endowment doing things that are actually undercutting our grant making? Is our endowment invested in things that is making it harder for people to access medication or harder for people to access education? And that's making us harder to do our jobs, even though it's generating a return. And once that conversation is started, it takes time, but the incentive structure realigns. It's not as direct as in traditional grant making or traditional philanthropy. there's a few more, there's like another axis for the financial returns, if that makes sense. But it's an interesting thing. I'll stop there. Any follow-up questions on this?
No, yeah, thank you. I think, one of the things that I've found to be, impact investing is looking to bridge this divide between people who are really oriented towards sort of profit maximization and people who are oriented towards, or they've worked for organizations where, quote unquote profits. I mean, anything that comes into the organization is turned into social services. And those two mindsets can be very difficult to reconcile. And so even conceptualizing and having leadership comfortable with, something that is trying to hit both ends and have building that trust feels like it can be very difficult to it can be
Yeah.
difficult. And that, like in my experience, I used to work for a global NGO and was large enough to, think about some of these issues and be the recipient, potentially be the recipient of different impact investment, products. And it was very, very difficult to think about because ultimately this idea of paying back funding to groups that actually have a lot of money is just, yes, you could talk about financial systems and how they work and all of this, but when you look at the amount of like dry powder that's out in the world, it's very difficult to kind of then think about, well, it's really important that this group or that group gets their, 4%, 3% below market return, even at that level. So yeah, I find it's a really interesting space. I feel like these are really important, but I think it's like what you said, like it's all negotiation and it's gotta happen in a very decentralized way in order for it to work because the mindsets are so vastly different.
Yeah, no, you're so right. I think healthcare and also education is another one. There are a couple sectors in impact investing where I personally have like a knee-jerk reaction of like, are you sure you need a profit? Because kids need to go to school and people need to get healthcare treatment. And at the gym, we sit in a space where we're trying to drive more dollars to the field. And part of doing that and part of catalyzing more dollars is figuring out other financial models. Anyway, I actually think, Jacob, this might be a good place to move to the benchmark demo because that might also answer and get at some of these questions. And I'm also doing a time check.
Yeah, happy to. Also, don't know what this is about. I just got a notification that my laptop's about to shut down in 10 minutes for updates. So hopefully it doesn't do that, but if it does, Maddie, I'm sure you can handle the Q&A.
Sure.
Awesome. So Iris Plus is one tool that the Gin made, but after Iris Plus was made and had been used for a few different years, oh, I guess we went back to the start. The question started to come of, okay, these metrics are great, but we don't understand them in context. We don't understand how these investments compare to other investments in the field, which is a really important question because, of course, an impact investor doesn't just want to make an impact. They want to make the most impact that they can. They want to optimize their impact to an extent. So the research team began hearing that context was the big missing link. All of this data was being gathered in different places, but it was really hard for an investor to say, oh, is $100 million investment that treats 20,000 patients a year. Is this above average? Is this below average? Is this average? It's really difficult to know because there's benchmarks for things like grants or philanthropy, but impact investing is a pretty different structure, which I think Rachel touched on well. So in order to meet this demand, the research team began building benchmarks, which in theory would allow impact to be compared to aggregate performance, that's the market, specific peer groups, as well as some of the global targets. Just like Iris Plus, this was a very ambitious initiative that involved getting many different investors involved in a long harmonization process, a long data collection process, and ultimately the construction of our free to use and freely available benchmarks. Benchmarks move from asking simply what data should be gathered to how does this data stack up? How do my investments as an investor compare to the investments of others? We released the first benchmark about a little over 2 years ago. And in financial inclusion, we've released agriculture and energy as well. And in the last 8 or 9 months, we've been working really hard to launch a healthcare benchmark, which we're excited to launch in this upcoming December. The healthcare benchmark was the result of a long process with many different healthcare impact investors who gave us their feedback and told us what metrics, what key performance indicators they believed were the most important to focus on. I'm about to show you a demo. It's not fully interactive because our tech team's still working on it, but hopefully it'll give you an idea of what kind of resources the GIN is trying to create to communicate with impact investors, to move past just having a similar language with Iris Plus and into being able to actually compare impact and see how it stacks up. And let me get that screen back.
Jacob, as you pull that up, I'm recognizing we have 5 minutes left.
Oh,
So
yeah.
if you wanna put questions in the chat, and as Jacob pulls up the demo, I'll start queuing up questions.
Nice. I can be a little bit speedy, but this is what our healthcare benchmark looks like. This is dummy data at this point, so don't think much of it, but it contains important information about the makeup of the field. For example, if you scroll down a little bit, you can see what stage of business impact investments are in, what setting of care they're in, and this sample is far from representative. It's very hard to collect impact data because it's kept very privately by companies usually. But what we hope is that this can start to provide an idea of what this sample looks like. So while you can't look at this graph of setting of care and say, well, most impact investments are virtual or specialized care, what you can say is that at least some are specialized and virtual. This is just the context, though. In terms of the actual impact performance, that's where the KPI tabs come into play. In tabs like these that are able to be popped out and show greater detail, the impact investor who submitted data is able to see how their investments, that's the green bar right there, compares to the average benchmark for key performance indicators like the number of patients treated or the patient saving premium. This allows investors who have submitted data to see how well their investments are doing relative to others. And even if an investor or you hasn't submitted data, they can still see the benchmark figures, which allow them to compare themselves to the market, to their peers via our advanced filters that can pop out and narrow down the selections. And finally, we also have an SDG tab that I won't go into for time reasons, but that also lets impact investors see the scope of change that is fully needed. This is free to use. You can go to the GIN website right now and poke around our old benchmarks. It'll be free to use when it launches as well. And really, these tools are pretty fast and never as simple as we hope for them to be, because like others have noted, this is a complicated endeavor and a complicated field. But I really encourage every single one of you to go in Iris, go in the benchmarks, play around, and see if you believe that there's something for you there. And Maddie and I are always available. This is our contact information. and I think Maddie might put in the chat too. But yeah, we would love to open up to any, I don't know why I keep sending me back to the first slide, but we would love to open up to any kind of questions, and wanted to thank you all so much for attending. Those of you who are here right now, and also any of you who may have watched this recording.
Rachel, I hope you saw, and also Cheryl, hope you saw during the different metrics we landed on. I think those are probably relevant to your business models. And I think I missed when we were talking about incentives for measurement. Investors love a good competition and hate being seen as less than other investors. So when we stack them up and show them underperforming in terms of savings accrued to a patient, or even in terms of just patients served, people hate that. They want to do better. So some friendly competition we find can be shockingly helpful. Any questions you all want to voice, and feel free to leave them in the chat, and also over email to us. Sarai, welcome back.
Thank you. So we're just waiting for questions now. If there's no questions, then we can just go ahead and end the session. The recording will be available in the lobby after the session, so people will be able to watch it as well.
Great. Well, thank you all for joining us.
Thank you.
Appreciate you all, and appreciate you, Sarai, for getting all of this together, and we look forward to being in touch.
All right, sounds good. Have a good one, everyone.
Take care.
Bye-bye.